5-year strategy for mental health services in Sussex, but also encompassing other things that affect young people's mental health, like education, early support, prevention, different things that can help young people's well-being. So looking at things like social prescribing, all those types of schemes to really just get an overarching view of how we can help young people's mental health.
Research shows that children and young people with special educational needs and disabilities were amongst those most affected by the COVID pandemic, where existing mental health needs were exacerbated or where huge periods of isolation have impacted on young people's confidence, social skills and anxieties. The system just isn't able to cope with rising demand, so organisations like Amaze are holding much higher levels of need.
Families and children and young people are struggling to get the support that they need. They are placed on a long waiting list. They have to wait till they reach crisis point. We have to be at a stage where we support children at the beginning of their journey. And I really hope that this strategy is the beginning of that and the beginning of making things better for families across Sussex.
This last year has been so brilliant for my own mental health in general, because such a wonderful experience to have, these very top people like commissioners actually want to speak to me and actually view my voice as the same level as theirs. As someone who has anxiety themselves and had quite severe anxiety for a long time, actually being that supportive environment, and even though I was helping to lead the sessions, I think, it really helped me to be able to, talk to these young people who are really understanding and empathetic. We spoke to many young people about what do we even want from mental health services in Sussex and what does that look like.
So the vision was to start a conversation about doing things differently as a system in order to achieve a longer lasting change and to make recommendations that turned into actions, as we didn't want to do more of the same. Its aim is to design a system which is built on resilience and wellness, at the same time as making sure that when children and young people do need a little bit more help with their mental health, that it is timely and appropriate to their needs, and that support is more easily accessible and comes early. The vision for Foundations for Our Future takes a more holistic approach to children's lives and promotes a better join-up of organisations and systems.
Hearing the voices of children, young people and families as we transform and improve services is key to our work. This strategy describes our shared ambitions and commitments to give young people what they need for the life they want to live. The 4 main priorities of the strategy are: prevention, helping children and young people to understand what impacts their mental health and what to do about it for themselves. Early help and access to support, giving families and carers the information and advice they need to support children and young people and treating mental health issues early. Specialist and timely support to meet high and complex needs. Some people will need more help and support, particularly those with disabilities, those who are looked after children, and those who may have experienced trauma or abuse. Support for life transitions. Supporting children and young people through big life changes, such as leaving school, home, or looked after care.
I think this strategy is really important because it involves all the professionals working together, and together we can look at implementing a seamless service, a joint-up service, so families do not have to go through different stages. They don't have to keep telling their story and have their voice heard.
The impact of Foundations for Our Future should be that children, young people and their families and those that care for them know who they can ask for help, where they can ask for that help. I have seen and been inspired by so many young people who deserve to have the support they need to have the best future they possibly can. I know that there are times when all of us struggle with how life makes us feel, and that getting through those tough times can need some support.